Welcome to the Long-Term Care Chronicles podcast. Thank you so much, Douglas, for coming on to the Long-Term Care Chronicles. And I know you're talking in regards to the Seniors for Social Action Ontario. And if you can just provide a little bit of background information about the organization and yourself before we get started. Thank you.
Yes, sure, Wendy. Seniors for Social Action Ontario is a group that formed in the springtime in response to what we were seeing happening in the COVID epidemic, particularly as it relates to people living in long-term care facilities, and just sort of tracking the tragedy as it was unfolding. We're a group of people that are basically seniors ourselves. We come from a variety of different backgrounds: social policy, law, social activism, systems advocacy, clinical work, post-secondary education. We also have family members of those that have lived and died in these long-term care homes as well. So we came together in the spring just to be able to start to really advocate for reform and serious reform and changes to what's happening for elder care in this province, which we can talk about, I'm sure, during this interview. My background is just that I spent 40 years supporting people who have an intellectual disability. I was providing support. I was a community developer. I was an advocate. I was an organizer. I was a manager of an agency. And for the last 20 years, I've been consulting with disability organizations across the country, but mostly in Ontario and British Columbia. And when I heard about Seniors for Social Action, this group getting together, and I knew some of the primary people, I just thought I just had to do something, that you had to take action around this. There was so much happening, and there was no one really speaking about the need to seriously reform. I don't mean tidy up the system. I mean change, reform it significantly. And so that's what brought me into this. And it's been 6 or 7 months of trying to get the attention of decision makers to do what I think every Ontario citizen wants, is a much better elder care system for everybody.
Yes, absolutely. I couldn't agree more. And with your organization, the Seniors for Social Action Ontario, there's 3 main, I guess, key aspects or key points that you guys are really championing for in terms of the change. And one of them is that the reliance of long-term care facilities to address the aging and disability aspect. And if you can just be able to talk on that, just be able to give more of a background on that.
Yeah, so this is a very interesting point, and it's sometimes hard for people to understand this because long-term care facilities are institutions by any other name. I mean, once you start congregating hundreds of people together in the same building, or in that format, congregating people who are not, to be honest, not highly valued in our society, or seniors need a lot of support, not highly valued. And by the way, I should also say that there's a significant population in long-term care facilities who aren't elderly. They're actually young and they're disabled. And somehow they found their way in there as well because they couldn't locate viable alternatives to be supported in their neighborhood and their community. So your question about our first goal is to really look at this whole thing about having these long-term care facilities, these institutions. So we know that what happens in institutions is that people's personality begins to disappear. Once you live with 300 other people, your personality begins to disappear. You get to be separated from friends, family, and community. You get to be excluded from events. You get to be controlled by other people. I don't mean sort of malevolently. I mean just when you have a couple of hundred people living together, you're going to be controlled. You give yourself over to the routines and rhythms of the institution. So the routines and rhythms that were in your personal life simply get waylaid in favor of institutional routines and rhythms. When you eat, where you go, when you sleep.
That's right.
How you engage. It's institutional life has its costs. And I would add to that institutions have been rejected by most every other vulnerable group in our society. For example, we don't have orphanages for children anymore. We don't have homes for special care for significantly disabled children who used to be placed in these awful places. We don't have asylums for those who have mental health difficulties. We don't have those large congregate institutions for those who have an intellectual or developmental disability anymore. We closed them all. Last one was closed in 2009.
Mm-hmm.
We don't have residential schools for Indigenous youth anymore. We've realized that gathering up, congregating, separating, and excluding people from life, the mainstream of neighborhood and community life, regardless of your ability, regardless of your health condition, doing that has a high cost to both community and to the person. You lose your individuality and you become routinized and what they call institutionalized. And then what begins to happen is you become very vulnerable to things like a pandemic, let's say. 1,900 people dead in this province, preventable, dead in the province, because of frankly, the institutional model. A little bit later, we can talk about alternatives to that, such as small homes.
Yes.
There seems to be no deaths in this province related to the pandemic, but 1,900 deaths. I think the other thing, Wendy, is just that something's happening in Ontario that's, I think, a little bit unique in Canada and certainly unique in Ontario, is that 60% of the long-term care facilities are controlled and operated by the for-profit industry. The three primary ones, Rivera, Chartwell, and Extendicare, are led by three former premiers of this province, Bill Davis, Mike Harris, and Ernie Eves. The profit margin in human service in the field of care, we believe, is fundamentally incompatible. Because when you have profit-seeking motives, it will inevitably look for what they call cheaper inputs. And some of the most important inputs in long-term care could be, for example, what you eat.
Yes.
Who eats you? What have we seen happen in these places? We've seen this domination of low-wage, part-time workforce that even the Conservative Policy Institute, the C.D. Howe Institute, said was the petri dish for the infection spread. Profit in care in the institutional model is doubly problematic, right? Not only do we face the associated with institutional living, the standardization, the routinization, the loss of personality and control, the loss of people coming even to see you. We couple that with the profit motive that is so strong in these institutional models, and we begin to see why we're in such terrible, terrible shape. I would
definitely, because this is your second point, right? For your group, is that correct? Like in terms of taking the for-profit out of the long-term care.
Yes, the for-profit motive has been extremely troubling in this field. And it has garnered an awful lot of attention. And part of that attention is that it controls what's going on in the long-term care system in this province. So nonprofits and municipalities have a smaller share right now, but we believe that it would be really important to take the profit motive out of care. We've seen that it's problematic. It has failed. Most of the deaths occurred, well, they actually occurred, to be honest, they've occurred in nonprofit and in the profit institutions, long-term care facilities. But in the extent of the infection and the death rate of the infection is much more pronounced in the for-profit sector. So just using the simple data, the for-profit sector failed miserably in protecting people from the pandemic. This was all preventable if people had had their pandemic virus plans in place, if they had their dry runs, if they had all their PPEs in place, which I've talked to several of the homes that I'm familiar with, the municipal homes, nonprofit homes, and they've had things in place. They were waiting for this. But it's clear that the profit sector, just the data says that it failed. You don't have to have opinions about this. Just look at the data and it fails. So the other thing I should go back to say, Wendy, about our institutional model, not just the profit, nonprofit debate now that's raging, but the institutional model. So the last couple of weeks, there's been a few studies that have come out. People are beginning to say, no, I don't want to go into the nursing home. I hesitate to call it nursing home, nursing facility, long-term care facility.
Yes.
They don't want to go there. We have data on some polling that's been taken. 91% of Ontarians say they don't want to go to a nursing home. What they want to do is stay at home with a good home care system. 0% wants to go to a nursing home. Now, the issue, of course, is people are reacting to the crisis right now, of course. But all my friends that I talk to, just talk anecdotally to the people that you know, your neighbors and friends, and say, are you looking forward to the nursing home? And people will generally about that. They'll say, oh, no, nobody wants to go. And we talk about it regrettably when somebody has to go, because people are usually in no other position. There's no other alternative. They can't find any. They're at their end of the rope in terms of what they can physically do to care for somebody who needs some help physically, or because of dementia, or frankly, because of incontinence. Then people become very, very concerned. And because our home care system is not very robust at all, not very robust, I would emphasize, it forces people into the institutional model that's primarily controlled by the profit-making industry. So Ontario citizens are saying they want to have a robust home care system. And so why does government persist with, last month, what was it, the announcement of 5,000 new beds to be bid on right now, a promise of 25,000 more bids and more beds on top of the 78,000 that they already have that are full, with lots of people waiting in wings of hospitals for their place. Really what they're waiting for is someone to die in a long-term care facility. That's so right. They can. We could easily, and depending what studies you're reading on this, but easily, if we had the most robust home care system, taking the caps off the hours, allowing people to have much more home support, you could easily take 15 to 20% of those 78,000 people out of the current long-term care placements if loved ones had opportunity and resources. You would incentivize their interest, provide them good support, and allow people to sidestep the institutional model. So it's incredible that Ontario citizens are telling the government what they want, and the government's just not budging.
Yeah, no, absolutely. I definitely agree, because I know for my situation, if there were the community supports available, my loved one would not have had the need to have gone into long-term care. And as you said, to be able to provide that independence, because once they went into long-term care, they're a much younger person. They're an individual that is of special needs. They lost, their identity. I really had to champion for them to be able to still be included into community. And gratefully so, I have been able to take them out of that, but that was a long 8 years of them being in that type of living environment. And not everybody is going to be able to have that opportunity or that chance to be able to fight, to be able to challenge, to be able to demand that they still be part of the community that they live in, as opposed to kind of shut it away in long-term care and then being told you're taking a bed away from somebody that needs it in the community, because they are not their typical individual that would be living in long-term care. And I guess that's what your organization is indicating in terms of the reallocation of funding for long-term care. And then, of course, as well, to make sure that the inspection process is a lot more harder to
Well,
account, right?
yes. I mean, this whole topic of accountability, Wendy, I mean, um, I dare anyone to tell me where all the money goes that's given to the profits. I dare anybody to like that. I mean, the profits have their hand out really, really large right now, looking for more money for all the understaffing that they have, and for redesigning some of their facilities. And I'm wondering, where did the money go that they've had before, and how come they can give out $1.75 billion in dividends to shareholders? What about that money? Nonprofits don't have that money. They put their money back into care. So it's a fundamental, the accountability of money, but the accountability also of what's going on in facilities is the mandate of the inspection branch of the Ministry of Health and Long-Term Care. And for the longest time, the 620, I think it's 24 or 627 long-term care facilities in this province, they're required to have a comprehensive inspection every year, which, puts the provincial standards against what's going on, and underscores when people are understaffed or they don't have the right number of nurses in the facility. Then this is, more regularly than you would think, when people are understaffed and don't have the complement that they're supposed to have. And the inspection branch, the director, has the option of giving directives, orders in this regard. And however, there's been a lot of pushback from the profit industry not to have inspections. So I can tell you that about 4 years ago, every nursing home in the province was inspected, had a comprehensive inspection. But last year, 2019, of the 627 long-term care facilities, only 9 received a comprehensive inspection. So the profit industry in long-term care in this province won. They won. They asked these inspections. They didn't want these inspections, and they got no inspections. And this is what bothers us terribly, is that there is something going on between the current government and the profit long-term care system that needs to be explored much more deeply. And it's really, really problematic. I mean, for example, when an inspector goes into a home and he sees that this is significantly understaffed, the first thing he should do is issue a cease admissions order. They don't even do that right now.
No.
It's fundamentally a flawed system, what we're seeing right now. And of course, I think you know this, Wendy, and a lot of your listeners will know this, but this is not new to people.
No.
I think there's something like 21 reports over the last 35 years that have brought forth these concerns in all kinds of different ways. This is not new. People know this. We didn't need, or at least a lot of people didn't need the Canadian Army to tell us what was wrong with long-term care in this province. They of course did in Technicolor, because they had to respond to the abandonment and abuse and neglect and starvation and malnutrition that was affecting people. So the Canadian Army got that credibility, got that stage for a short period of time. But even immediately, our government comes out, Doug Ford comes out and starts saying, we're going to build, his idea of innovation is building new beds faster, instead of us saying, no, this is not what Ontario citizens are asking for. We're asking for a robust home care system. We're asking for, quite frankly, alternatives to institutionalization. Why can't we have supported independent living models like people with significant disabilities have, both those with physical disabilities and have significant intellectual disabilities?
Yes.
We have supported living programs all across this province, all across this country, that are being made use of by people with physical and intellectual disabilities. So supported independent living is one option. The other option that I think is interesting to consider if we're looking at alternatives, because if we're going to stop institutionalizing people, what do we want to see in place?
Yes.
There's supported living options are already been running for 40 years in this province. So let's take a look there. Second thing I would point people towards is different types of approaches, such as Newfoundland and Labrador have the paid home caregiver program where a family member can be compensated for caring for another family member who's elderly and in need of support or disabled. So why can't we look at something like that? And physically disabled adults in Ontario have direct funding where they can actually access direct funding themselves to be able to, the people that they want to be able to support themselves. And if they have some family members assisting them, because maybe there's some dementia involved, family members can support that person in their decision-making about how direct funding can be used.
And with that direct funding, that follows the person, right, throughout the province, not necessarily the agency where they would be attached to.
Correct. So direct funding, we've often referred to this as individual funding or direct funding, is a way of flowing resources directly to the person affected so they can have control over how those resources are spent. And it could be hiring people, directing them. They're accountable for managing the resources. But you know, so you can do it yourself. You can do it with the help of people. Or quite frankly, if you get innovative about this, you might be able to direct those resources to your church. And your church does the administration and helps you a bit. You do the hiring of somebody you know and trust. There's many innovative ways you can do this. And what we're talking about right now, Wendy, this direct funding, this has been going on since 1983 in the field of developmental disability. There were programs. One was called Special Services at Home. Another was called Support for Adults. So for almost 40 years, we have experience with direct funding. It's also been happening for people with physical disabilities, physical disabilities, for almost as long. And so we know that we can empower people by using those kinds of resources that don't have to be sent to the profit system, or even the nonprofit system can be sent. It's another option to be invested directly in the person who needs it. And they, with enough, if they need help with their managing this, can enlist their family members and loved ones to help with this. So, and the other thing is that in the field of disability, you'll also see small homes that have emerged. In the field of disability, 5,000 people came out of these large congregate institutions that were scattered around Ontario between about 1984 and 2009. It's about a 25-year period. And as a result of that, many people found themselves in these small homes in neighborhoods, on ordinary streets in the community. And many of the people that came out of the institutions were quite significantly disabled, needed a lot of assistance, physically, intellectually, and some health-wise. And the small homes simply provided an opportunity for people to still connect to community quite strongly, for their personality to be present and seen and be a driving force, for them to have much more, instead of the assembly line care of 200 people living together in an institution, their individual routines and rhythms of the day could be supported. So all the people living if there was 4 or 5 or 6 people living in a small home, they didn't have to all do the same thing. Yeah. They had good amounts of staffing. It was person directed, so direct person. So the empowerment of staff to recognize that this is about supporting the autonomy of this person. So getting to understand the person, getting to assist the person to express their preferences, regardless of level of disability, regardless of dementia, regardless of health condition. We all have preferences. So in a small home model, what the staff are empowered to do is to animate those preferences.
And that would be a very good model, because the way that it is now set up, it's all task oriented. And as you said, you lose individuality. So it's all what the group has to get done. You have to get up at 8 o'clock, and you have, support workers coming in and making sure that you're up and ready and dressed in 6 minutes to get to have dining, because staffing for dining in that area is only there for an allotted amount of time before they have to do their other tasks and move forward and have the steps keep going. So I guess what you're saying as well is that there would have to be some sort of a standard, some sort of a model to say this is how long-term care should change going forward, as well as to make sure that the community support model is just as robust as the long-term care model, not looked at in different silos, but looked at together to provide the support for the employees that are working in that model, so they don't have to be working 2, 3, maybe 4 jobs just to have ends meet, because that's another aspect of it, is not recognizing or valuing the work that's being done for those particular individuals as well.
Yes, absolutely. This needs to be a holistic system of elder care in Ontario that understands it's better and cheaper to support people to live in their home. If we're going to spend upwards of $175, $200 a day per bed in our institutional model, then why can't we take a decent percentage of that and redirect that to a more robust home care system where people can access more hours of support? I mean, right now in Ontario, and I have personal experience with this, as a lot of people do that are listening to this podcast, so this isn't theoretical to me. I mean, right now, if you're in palliative care and you're going to get the maximum number of hours, and you've chosen to pass away at home, for example, then our home care system will start giving you a few more hours than you currently would have gotten. But the hours prior to that, you might be getting 1 hour a day or 2 hours a day, which is ridiculous for some people. It's not great. You can't keep a workforce. And I can tell you, in my situation, when the home care system was unable to send any PSWs, they could not find anybody that would assist this person to die at home. And so that was left to the family. They had approved the hours, but did not have any workforce that was available. And this is 30 minutes outside of our nation's capital. So this,
Yes.
the home care system is in disarray. And recently, this past week, I read a report that was confirming the fact that seniors did not want to go into an institution, but it was also confirming the fact that 400,000 recipients of home care needed more support than they were getting. They weren't getting what they needed. Either workers don't show up, workers aren't available, the hours aren't adequate, and yet 91% are saying right now we want a more robust home care system. It's just unconscionable that we've got the system we've got, with people saying what they're saying about what we need to put in place, which is not new. We know what the problem is. We know how to solve it. There doesn't seem to be the political will to do anything about this at this time.
No, there definitely does not. So what I'm going to do for home, and of course the funding following the person and not the institution. So
Yeah, I think Wendy, there has to be a range of alternatives. I think institutional life, nobody is saying they want that. Nobody wants that except maybe the profit system and this government. But everybody I talk to says no, they want something else. They want to be home. So one thing is a robust home care program, but there is a need for people to have access to other supported living models, and especially if we're going to help some people maybe leave the institutional model. And so I think by redirecting funding, we can have a support. Well, I'm calling it supported living, and it simply means that we can have homes in the community that could be rented, renovated, purchased, uniquely designed, because people may have mobility issues, of course. And so you can have homes, and it could be either developed by the municipal or the nonprofit sector, these homes on streets, in neighborhoods, in community, in proximity to each other, and have a small number of people living together where their personality is recognized, their routines and rhythms are recognized, where staff don't have to wear uniforms. They can just be people that are helping people. We don't have to label people. One of the things we've done, of course, is we've medicalized the elderly. And so all of a sudden, personal support workers, PSWs, are wearing these uniforms when they come to work, where, I mean, in the field of disability, none of that doesn't happen. People wear their ordinary clothes. So we don't want to stigmatize and label people. We want people simply to age where they feel most comfortable, provide support. And then these homes, most likely they have to be, accessible. They might need specialized support that would come in. So, for example, I'm quite familiar in my town here with a woman who has sort of an early onset dementia, needs a lot of help, but she also has a nurse who visits, a physio that visits, an occupational therapist who visits, somebody that helps if she has difficulty swallowing. And so you can arrange for these specialized services. They don't have to live in the home, they can visit, because you don't need this service all the time. And so we had more homes located in the community, small homes, and frankly, people could get quite inventive about this. I mean, as people think and plan for their future getting older, they might be able to actually own a home that's shared with one or two other people. I mean, you can get into shared living models.
Yes.
So supported living, small homes, shared living models, direct funding, robust home care. All of this conspires to create an alternative to the institutional model, which we've just grown up with. And part of this problem is Well, there's a couple of problems that are associated with it besides the profit element. One is become culturally normative to pass people on to the institution.
Mm-hmm.
It's regrettable, and people say it with a tinge of regret. My mother, my father, my brother, my grandmother had to go to the nursing home. It's almost, there's a tinge of regret when you talk to people about this. It was like they'd done everything they can possibly do, and we had no other choice, we had no other option, and this is what's happened. And so there's this regret that's there. And the other thing that I think touches people quite deeply is we live in a culture that highly values individualism and independence. And I have lived in cultures. I lived overseas for 4 years in a culture where they would be scratching their heads about how we treat our seniors, about our older people. They simply would not understand why we put them in those big boxes over there.
Yeah.
So we have a culture where we don't want to bother our children. So we go to the nursing home. We have a culture where we're so busy we don't have time for each other. We have a culture that's making people have, all kinds of, part-time jobs and 2 working incomes and all this stuff that's conspiring to take us away from each other, to make us cogs in this big production machine of money and life and things. And probably the most valuable thing we can do is support a family member who's a bit vulnerable. I mean, I think that and so if I can join that comment up with some sort of economic and social policy,
yes,
live in an individualized culture, and I don't expect we can change that this week, but if we live in that kind of a culture, then why don't we incentivize people to take care of their loved one? With whether it's simple like time off work, or is it more a bit more complex, like Newfoundland and Labradors pay the home caregiver program that they have, which could be looked at, and just to be more responsive to the fact that incentivizing family and loved ones to care for people is a noble thing to do. It is so economically feasible. We have social policy that talks about this. And we could even establish, if you wanted to sort of blue sky some ideas, you could establish a refundable tax credit system that verifies somebody who's older, let's say with dementia or conditions that require support. You could verify that. My goodness, we do all kinds of things with the signature of somebody who signs your passport or whatever. We can verify these things in many different ways. We could establish a refundable tax credit system that would incentivize people to also support their loved one and not jeopardize their own need to live and have income and raise a family and all the rest of those things that people do. And like in other cultures though, where there's a bit more of a social background, a sense of social responsibility, they come up with other models. I mean, in Sweden now, you'll begin to see intergenerational homes being established. So where there might be older people in a home with much younger people and middle-aged people. And it's just a way to understand that it's not all about productivity and competition and this myth of beauty and this individualism and this search for wealth. It's also about patience and tolerance and understanding and diversity and helping each other. That's what this is about, and that's what needs to be incentivized. And we're just being swamped with all of these other economic and competitive values that tend to rule a society at the risk of not supporting each other, quite frankly.
Yeah, Oh, definitely. I would definitely agree. And a lot of what you said is exactly what I definitely experienced supporting my family member during the last 8 years in terms of, making work more accommodating to a caregiver, to have the community supports that are there, because currently it's not there, which is why they are indicating to, unfortunately, I'll use the word dumping individuals into long-term care, because that's seen as that will resolve the issue. It's just that they're not willing to come up with a plan, to come up with something that is feasible, that can still have someone, if they can, still be able and to be active within the community, and to have a balanced approach, because some of those resolutions are quite severe for family members, that there wasn't anything in the community to be able to assist, because they ended up finding it that much more challenging in long-term care. Because I know for myself, I was classified as having caregiver burnout for, my loved one being in long-term care, as opposed to if they were at home.
Yes, yes. I mean, Wendy, that story has to be a common story in this field, with hundreds of thousands of people now beginning, thinking about supporting someone in their family who's vulnerable. And if there isn't anything out there, we take we take what is available and then live with ourselves. We almost have to rationalize the choice that we've made in terms of placing our grandparents in a nursing home, for example. We have to live with ourselves, even though we know in our back in the back of our mind, maybe there could be something better. But when we can't sort of even imagine that, because we've been caring for somebody for a while, we can't imagine what could be there, let alone have the strength to change a provincial system. Oh my God. It becomes extremely difficult. And then people, of course, have to justify why we need it. And the reason people need it is because there's nothing else there. And that's a hard
Yes.
understand, that vicious cycle of, it's not there, so I take this, I rationalize it, therefore I need it.
Yep.
And quite frankly, the other thing that happens, and this happens everywhere in not just in elder care, but the responses that we've made to people in social service, after a while, they become the human need. So someone will say, my grandmother needs a nursing home.
Yeah.
Well, in fact, nobody needs a nursing home. What you need is a good place to live. And then you could ask somebody, well, how many options could you consider? How many options do you consider about a good place to live? Okay, let's put nursing home out there. What else? And
Exactly.
people break through this mental prison that's been created for us, because we've only had certain responses to look at, and then we connect that response, nursing home, with need. It's a false need, because you don't need a nursing home, but we've created that false connection that you need
Yep.
a nursing home, or whatever it might be. Yeah. So we really do have to, when we do our planning, and that's the other thing about, I do think it would be very helpful for some families to have access to somebody, maybe it's from the healthcare system, somebody who's trained differently, who can help people think differently about how to support their vulnerable family member. Because we come from a variety of backgrounds. We're construction workers, and we're builders, and we're inventors of something, and we're retail workers, and we're school teachers and nurses, and we don't all have the imagination to think about how this could be done differently. And if there was somebody who could independently sit with families when they're in a situation of wondering how they're going to support this vulnerable member, whether it be a person with a disability or whether it be an older grandparent or parent, and then begin to think with a wide angle lens, what is possible for us here? What resources are at our disposal? What could we access for the government systems? What resources do we have? What about our community? What about our neighbors and friends? What about our other family members? Could we think about this in an entirely different way? And if we do that, I have enormous faith in citizens to come up with creative ways of doing what's right for people. And in times past, there was just no options, no one to help, and people did what they could do. My grandmother had MS, and for lack of a wheelchair, she spent 20 years in a long-term care facility. And this was a long time ago. But what she needed was a wheelchair and an accessible house. And because that wasn't available, the next 20 years up until her death was spent in a long-term care home. So we could be thinking with people so differently, because of course people are restricted in thinking about this. You and I probably think about it more than most people. So maybe we need that. Maybe we need that element in a reformed system, someone who can help independently with planning and facilitating what can happen new and different.
Definitely, I totally agree with that. And as well with the, I guess, now how do we then get the government to listen? And how do we get the government to start implementing some of these plans, some of these outlooks, start looking at some of these things? How do we as individuals then start championing our local politicians to get, things changed and actionable changes that we can actually see in our lifetime?
Yes. So, Wendy, I'm with you 100% on this. The power is with the citizens of Ontario. If this government will not listen, I will tell people today, as we're taping this, I can tell people today, and I'm politically nonpartisan.
Yeah.
I am. But I can tell you today that we have been speaking with the political parties, and the one that's listening right now is the New Democratic Party, which is the official opposition to the Conservatives. Last Friday launched their long-term care, home care plan, the plan for elder care in this province. And I must say, I was very suspicious when I heard about the plan coming forward. And of course, we know politicians and plans and election promises and all that stuff. I have talked to them. I have heard them speak about this. I have read the plan. This is one of the best plans that I've seen come out about long-term care in this province. And I would encourage people to take a look at this plan. Not that the NDP, it's the final answer, but what we have right now in the political arena is finally some party that's listening and saying, okay, we can make a robust home care system. We can take profit out of care. We can have small homes in the community. We can have an inspection branch with teeth that can do something when things are problematic. That's what this plan talks about. So an election promise, maybe, but at this point in time, is what I'm seeing as the first sign of listening to the over 90% of Ontarians that are saying this. So in order for this to happen, the people listening to this podcast have to stop after this is over, and they have to spend the next 10 or 15 minutes writing a letter to their MPP. They have to become politically active, and they have to say, I want to be in place what the NDP's plan is saying, or they have to say, I want in a robust home care system that will allow me to age in place in my home where I want to be. Or I need to say in this letter to my MPP that we have to stop institutionalizing people, because we only now institutionalize prisoners and senior citizens. The power is with the people today. No government, I've said there was 21 reports over 35 years. No government has changed the system. So it's not just the Conservatives, although they seem to be in bed deeply with the private for-profit system. The Liberals didn't change it either. And so we need to have a voice from the citizens of Ontario. And that doesn't happen unless we spend our 10 or 15 minutes, and that's all it takes, on your computer to send a letter to your MPP, and then to keep doing that, to keep being active. This is a multi-billion-dollar system that is not meeting the needs of almost anyone. Of course, some people will say they're satisfied. That always happens.
Yes.
Happened in the institutions for those with an intellectual disability, when some families members sued the government to keep them open because they wanted their child to stay there.
Yeah.
But we know, en masse, people want to change here in Ontario. And it's not going to happen unless the citizens voice their opinion to their members of elected parliament again and again and again up until this coming election. So I think that's a very important thing to do, is to become, you don't have to become a marching, card carrying, placard waving person, just a citizen who cares and who's seen the tragic results of a terrible long-term care and home care system in this province.
No, absolutely, because as well, there's a lot of other organizations that are rising up to say change needs to come. We cannot have this here in Canada, in this particular province of Ontario. And would you say another step would be as well to write to their member of the federal government as well, to be able to elicit that change as well, and to hold the provinces accountable for the changes that should be coming as well?
Geez, Wendy, I think you're absolutely right. I think every listener should have their member of provincial parliament and their member of federal parliament's phone number on speed dial, and they should have their address in their contacts list, and they should be contacting them both for similar but different reasons. At the national level, for example, why aren't there, if there's transfer payment dollars that come from the federal government to the provincial government, why can't we have standards for the provision of elder care in this country? And these will be minimum standards, but right now we have no standards about this. Or why couldn't have a refundable tax credit program that allows people to take care of their family member who's vulnerable and to not lose income, for example, for doing something like that? Why couldn't we invent that? So I think that the citizens of Ontario need to be active and in contact with both at the federal level and at the provincial level, your member of provincial parliament. And if you've never, your member of parliament, federal or provincial. And so if you've never done that before, it's quite simple. Just Google their name, find out their address, and write a quick letter to them. Start that dialogue with them this afternoon.
Yes, absolutely. I definitely 100% agree. And I know that your organization has been as well, you've sent a letter into the commission that's being done here in Ontario for what should be as changes. Can you just speak a little bit to that?
Yes, I mean, I think people may know that the Ford government has set up an independent commission to look at the tragedy in Ontario, what happened, what they could do about it. They have wide-ranging mandate. Should they so wish, they can make recommendations on the future of elder care in this province. Now, I think we're not holding our breath about this. But if you, some of us read the transcripts that are coming out from this, we're finding out that it's as bad as we thought. The inspection branch was in front of the independent commission last week, and they were bringing forth what's actually going on in the inspections of the home, which is extremely problematic. It would raise the hair in the back of your neck to read some of the transcripts here. But we have to make ourselves use the vehicles that are available to us to make some headway. And so Seniors for Social Action has put a brief into the Independent Commission. We've put a brief into the Ombudsman, asked him to investigate various things. We've put a brief into the provincial government in the pre-budget consultation process. So we are extremely active in putting forth these positions of the need for reform, the need for to stop institutionalizing the seniors, the need to develop alternatives to the institutions, which we've spoken about today somewhat, the need for robust home care, the need for an inspection branch with teeth that they can do something about when things are problematic. And so, and this is what, I also want to say to remove profit from care. This is so problematic,
Yes.
so problematic. So I think there's all of these avenues available to any citizen. You can do this. You can Google the Independent Commission, get their contact details, and send your opinion into them. They shouldn't just be interviewing. They have the mandate to allow for public presentations. Whether they exercise that mandate, we don't know whether they will or not. Right now, they're listening to the people inside the government. So we can send our briefs into them. And if you want, if you're concerned about things, into the ombudsman's office. And even, I'll tell you right now, on the docket in the provincial legislature floor today is a private member's bill looking to establish a seniors advocate office who can investigate things on behalf of seniors. This is a private member's bill that's coming forth, that's being debated right now. So today, for example, I just took my pen and I wrote, or I should say my computer, and wrote a letter to my MPP, my Member of Provincial Parliament, asking him to support Bill 196, the establishment of a seniors advocate office in this province. Everybody can do this.
Thank you so much, Doug. I really do appreciate your time and for you coming on and speaking about your organization. So hopefully people will take that information and go with that and move forward to affect some change within this province.